Hey guys, I'm Channing from PTSMC in Plainville, and today we're here to talk about trigger point dry needling. So before we demonstrate dry needling, I want to answer a couple common questions that we get. So one of the most common questions is it the same as acupuncture? So dry needling and acupuncture are actually really similar. We use the exact same needle, however there's some differences in theory. We base dry needling more on trigger points and a more musculoskeletal exam, trying to localize where the person's having symptoms and the tightness in the muscle tissue. Whereas acupuncture is a bit more based on energy flow and chi and things like that. So another common question we get is what's actually happening when we do dry needling? So without making it too complicated, we find that these trigger points are really more chemical in nature. So with these trigger points and tightness of muscle, there's an excess of acetylcholine and calcium. So those are neurotransmitters that really tell muscles to contract. It's a very normal thing. However, with trigger points, we find that muscle's chronically tight and those chemicals are chronically being released. You're getting this muscle contraction or a spasm when it's not really desired. So when we perform the trigger point dry needling, the purpose is to stimulate that muscle fiber and get those excess chemicals to release, and we call it clearing the area so that you're not getting that constant contraction and that constant muscle spasm. So with the needling, people ask, what should I expect? What is it gonna feel like? It's a bit of a difficult sensation to describe. It's more of a crampy type feeling. It's not the most pleasant, but it should give you a pretty acute change as far as pain and feel much better than when you walked into the clinic. So with dry needling, the patient's gonna feel a few different things. They're gonna feel the tube on their back. They're gonna feel a little pinch. You really don't feel too much with that. And then a bit of dull achiness as we get into the muscle tissue. So once we're in, we do move the needle a little bit. It's referred to as pistoning. Just trying to get all portions of that muscle to release. Typically 10 to 15 seconds, and we're done. For any more questions about trigger point dry needling, feel free to visit our website, ptsmc.com.